Hi, I'm Amy Roundtree, an associate professor at the University of Houston downtown. I hope that you'll vote for my proposal, 5 Ways That Health Decisions Don't Make Sense. The topic emerged from some usability testing and qualitative research that I conducted as a consultant at the Texas Medical Center here in Houston, Texas. So current models of evidence-based decision-making and patient-centered outcomes all share a same common assumption. If you give people, patients, or providers enough information in an accurate way and with plain language, you'll improve their capability to make decisions. And that's so. Recent research into patient and provider attitudes about treatment and social influences on persuasion and decision making suggest the opposite. For example, individuals equipped with information are the best locus of decision making according to traditional notions of evidence-based research and patient-centered outcomes research. However, we know that our research suggests that communities of color and communities from non-Western origins often see authoritative figures as the loci of choice, more so than individual selves. Or they might situate the loci of choice in the community itself. They might have the community help make the decision for them. So according to these cultures, making the decision independently might actually compromise best outcomes and community independence. And often in these communities, saying no to making a choice, ceding authority altogether, is the best choice or the optimal choice. Usually, decision guides meant to help evolve evidence-based medicine also outline an overabundance of choices. They might offer every finding that a systematic review or a meta-analysis has to offer about a certain treatment or an intervention. So the wealth of information provided implies that presenting all of the information as much as the research uncovers will help consumers make better choices, and also not necessarily the case because studies suggest the opposite. Namely that the more options presented when making a choice, the poorer the decision and the worse the decision maker feels about the decision they've made. So my presentation will cover what I think are the 5 most controversial findings, particularly findings that are counterintuitive if you buy into the current paradigms of evidence-based medicine, and I will offer up solutions to rethink how we make decision aids and also how we evaluate decision making in health and healthcare. Thanks.